I'm Beverly Kirk with the Global Health Policy Center here with Dr. Zaher Sahloul. He is president of the Syrian American Medical Society, and we are talking about the ongoing violence in Syria and the efforts to help doctors and other healthcare professionals in Syria. Thank you for being here.
Thank you, Beverly.
Your organization has been working with doctors inside Syria. How are you able to do that? How is it going?
It hasn't been easy. As you know, there is targeting of the healthcare system in Syria. Many of the physicians that we are working with, and many of the physicians who are going in medical missions from SAMS, are basically exposing their life to danger when they are helping there. So the situation is terrible. Half of the Syrian physicians have left Syria because of the violence and because of the targeting of the healthcare system. And we're trying our best to support the ones who are remaining because we know that their role is very crucial to save thousands of Syrian lives.
Let's talk about the humanitarian situation that these doctors are encountering if they're, assuming they're able to get in and to help people in the areas where the refugees are fleeing, both inside Syria and then on the border areas. Describe for the audience what they're seeing, what they're finding.
Unfortunately, Syria right now is the worst place on earth in terms of humanitarian crises and disaster. We have a horrible situation. We have cities that are being bombed with barrel bombs, with ballistic missiles. We have populations under siege. About 250,000 of Syrians are under complete siege, cut off from the outside world, where ICRC and Syrian Red Crescent are not able to get into them. We had reports from one of the refugee camps, unfortunately Palestinian refugee camp in Damascus, of people are dying of malnutrition and starvation. And because also of the deterioration and the disintegration of the public health care systems, we are seeing diseases that were extinct in Syria, like polio, and now resurfacing again. So I would say that the situation now is much worse than last year, and it needs urgent assistance from the international community.
You mentioned the targeting of healthcare workers and of doctors. What are the prospects for a humanitarian corridor being opened up so that medical professionals can get to the people who are in such desperate need?
The situation in Syria right now that we have a divided country. So we have part of the country that is under control of the government, and the government is keeping a close tab on the international NGOs that are working there. So in a crisis like this, you would accept a flood of NGOs trying to help the population, and the Syrian government is only allowing 16 international NGOs to work in the territories that they control. And they're not allowing them to go into the areas that are under siege or to the other side that is controlled by the opposition. The other part of Syria, under the control of different battalions or opposition, the only way you can access that area is from Turkey or Jordan or Lebanon. So NGOs like SAMS and Doctors Without Borders and other NGOs have to cross the border, send medical relief, medications, and medical missions cross the border with the huge difficulties, logisticals, and because of the unsafe environment and lack of security. And that has been exacerbated lately because of the infighting between the moderate opposition groups and the extremist opposition groups. One of the hospitals that we support in Aleppo had to close and suspend its operation completely because of this infighting around it and because of the barrel bombs that are being thrown. But in spite of that, the local physicians are doing a heroic job, and we're trying to support them as much as possible. The prospects of humanitarian corridor will be very helpful, and there is a talk right now in Geneva conference that is being held in Switzerland right now about opening such corridors, and that will ease the situation and make it much easier for SAMS and other organizations to help.
Dr. Sahloul, thank you.
Thank you very much.